Indigenous medicine, Indigenous healing systems are firmly in place, and that they work, and that they need to be part of the treatment and care plan for our people when they come into our system.
Elder Diane Longboat is one of the 3 members invited to speak on the importance of integrating Indigenous practices within Canada's healthcare system at this year's Canadian Psychiatric Association's event.
We do need more work for culturally grounded research and culturally grounded clinical services.
Longboat is Mohawk from 6 nations of the Grand River Territory. She is an elder in the Shakwa-Bay-Mukwa Leadership Circle at the Toronto Mental Health Hospital. This is the first centre in Canada to lead a culturally responsive way to provide healthcare for Indigenous people.
And I recommend having a First Nations, Inuit, and Métis standing committee of the board.
Longboat said institutions should not wait on governments to implement better healthcare for Indigenous patients.
They have not taken seriously the stories of our people. They have not taken seriously the mental health and addiction challenges that have been a direct result of government policy. And so until the Government of Canada and the provincial governments take the voices of our people seriously, we will continue to see so many of our people suffering from inadequate housing, poor education, poor access to mental health care.
Panelist Dr. Jason Pennington is a member of the Huron-Wendat Nation and a surgeon at the Scarborough Health Network.
The impacts of colonialism, racism, social exclusion. Those are the things that have happened to Indigenous people, and until we address those basic needs, we will never attain health equity with the rest of the Canadian population.
He identified 3 of the Truth and Reconciliation Commission's calls to actions that need to be implemented. The calls to action he identified include increasing the representation of Indigenous people within the healthcare profession, and requiring students in the medical field to undergo Indigenous-centered training.
The healthcare system should do a better job embracing Indigenous health concepts and practices.
Pennington says this training should not only be taught in schools, but that this education should be continued throughout one's professional career.
It's something each and every healthcare provider has to be continually working on.
Savannah Craig, APTN National News, Montreal.